I have a lifelong visual impairment, and also in recent years I've had increasing difficulties with anxiety, and my doctor referred me to the Wellbeing Centre in Lewes. The normal practice at the Wellbeing Centre, I was given a key worker, and I talked through my needs and difficulties with my key worker in private and in a very conducive and pleasant atmosphere.
A wellbeing centre is somewhere people can come who need support around their mental health. So that it's open 5 days a week. People can come meet with a member of staff. If it's useful to have one-to-one sessions with that member of staff, they can do that on a regular basis. There's also lots of groups and activities that go on here. So that's all around helping to improve people's mental health and well-being. So there might be some art groups, craft groups, something around people's physical health, such as a walking group or a running group, any activity or group that might support people to improve their mental health and well-being.
The centres are different in terms of design physically. Some of them have got big rooms, some of them have got many little rooms, and they use those as appropriately as they can to have groups, meetings, discussions, activities that are helpful in encouraging people to feel safe in the environment and to make good use of it, and also to share the experience, their experience with other people.
So the East Sussex Community Network is a network across the whole of East Sussex. It's made up of our 7 wellbeing centres in different parts of the county that people can access. We also have a peer specialist service. So the peer specialist service is people who have had their own lived experience, and they've also had training. And they are based within the wellbeing centres, and they offer people support, and it's about them using their own lived experience and their own recovery journey and their own life story really to support people. And we know that people can find that really helpful, just to talk with someone who's been through what they're going through at the moment, and it can also really offer people a lot of hope that they can actually come out the other end and then use their experience to help other people.
A part of me wants to be useful as an individual, as a citizen, and I feel less anxious when I'm in a context where I feel safe and useful. So I joined a peer support training program which went on for 9 weeks and which was excellent. Again, I met other people, shared with them. The training was very helpful and useful, targeting what we need to do to help each other and understand another person's needs.
The other parts of the network we have a service called the Thinking Well service, and that's a dedicated service for people with a diagnosis of personality disorder. That service works in partnership with Sussex Partnership Foundation Trust, so we have a clinical part of the service and a community part of the service, and Southdown has the recovery workers who work in that part of the service. It brings together the clinical programmes that are going to help people to be able to manage their personality disorders and the symptoms and the emotional distress that might go along with that, but it also offers the similar activities that happens in the wellbeing centres.
It's a safe place. It's a place where you can say, in certain contexts, anything. There'll be somebody who's around you who knows what they're doing. I always trusted, and still do trust, the key workers that I've had. I had one in Lewes and now I have one in Hastings. They are excellent, patient people. In my case, they need to be patient. But I can contact the Wellbeing Centre at any time to say I really need to talk to somebody.
We also have a Staying Well service, which is an out-of-hours service. That's based at our Hastings and St Leonard's Wellbeing Centre, and it works from 6 till 10:30 in the evening and 3 till 10:30 at weekends. And that's specifically for people who feel they're not going to be able to get through the evening or the night. They don't actually need a medical intervention or a clinical intervention, but they just need someone to talk to, someone to talk about what crisis they're going through at the moment, and the staff will work with them to think about what they're going to do the next day, what other means of support they might have that they can access, and if they need to be referred somewhere the next day, they can do that. So
basically, I get a concrete feeling of safety and security here, and I can rely on that.